Hello everyone, my name is Kriti Singh and I'm working with an NGO named SAATHII. It stands for Solidarity and Action Against the HIV/AIDS Infection in India. I'm working here as project director and looking after two projects, one on gender integrated response to COVID priorities in India and the other on pediatric TB services. I'm very grateful to be part of this India leadership journey, and during the course of my journey, I've learned a lot. And I aim to work on operationalizing gender mainstreaming in SAATHI's health programs. Women continue to bear disproportionately the burden of disease morbidity and mortality due to lack of access to gender responsive health services and control over resources, as well as healthcare decisions. Limited availability of gender disaggregated data, which is often concealed in averages, prevents evidence generation on the differentiated impact of health on the health of men and women. Gender mainstreaming has been identified as a key approach to attain gender equality in health, and gender statistics is considered a powerful tool that makes visible the magnitude and intensity of the differentiated expression of gender inequality. Integrating gender concerns into health programs is essential to close the gap in gender disparities and generate evidence around how these gender disparities manifest in different ways in varied cultural settings is important. Capturing gender disaggregated data across multiple dimensions therefore becomes necessary. The aim of my project is to embed gender analysis starting at the design stage in all projects and programs, as well as institutionalizing a mechanism to conduct evidence-based research for feedback into planning and programs. Further, I understand that promoting women's participation and leadership in all forms of decision-making is essential for promoting gender-inclusive policies and programs. At the same time, and on this, I started working on identifying allies within the organization who could work with me as internal champions and also identify external champions who can work at the grassroots level and can bring to attention the context-specific issues in their region and develop their capacity so that they are able to solve their problems at their own level. This particular slide presents where I am in operationalizing my project with respect to my organization. So I have completed stage 1 and stage 2, and I am now working at stage 3, which is around knowledge building within the organization. And the red boxes, which are strategic planning, organization starts using gender lens. These are, to an extent, I wouldn't say is not there in my organization, but we will work towards achieving this also. Apart from allies, as I mentioned, I've also worked with internal champions, and I'm also working in Odisha in a district named Puri, where we have demonstrated while working with 17 volunteers in 21 villages, where they have been able to identify issues which were important in their region and have also come up with solutions, which included holding of sensitization meetings or health camps. These particular slides present the program which was being implemented and how our volunteers have been able to hold health camps and sensitization sessions on issues affecting their population. Further, apart from working in the field, I've also worked with other members of my organizations who are working on different projects. So I've identified one project where I'm working with the training of healthcare providers and how the outcomes were different for both male and female healthcare providers. We also undertook qualitative interviews with female MOs to understand what are the challenges they are facing. And at this point of time, the project members are being part of this whole process are also aware of the findings and are in the discussion on course correction. The leadership journey has been enlightening and gave insights on the art of using my voice to make impact. It began with my evaluation of my skills and the areas where I need to make improvement. I realized that I was not alone with these innate biases of self-doubt and underestimating our influence, and it helped me discover a supportive community among the cohort members who shared the same challenges and have confidence that they will be there to lend a helping hand whenever needed. My learnings from this journey has been mainly that it gave me confidence in my abilities to bring change. Apart from this, I realized the importance of investing in developing other women leaders, both within the organization and outside, who would help change their journeys, but would also work with their communities on changing theirs. The mentorship program helped gain greater clarity on the project implementation strategies, and today I feel more confident about my capacities, have more ambitious plans and strategies for to achieve goals that I've set for myself. I would conclude by a quote by Melinda French Gates: "A woman with a voice is by definition a strong woman, but the search to find the voice can be remarkably difficult. This voice is your best tool in the boardroom. Once you find your voice, hone it and practice." Further, to add to this, I would say it's the responsibility of those who have found their voice to help others find their voice and join in this service to help inspire and motivate women and other genders to reach their full potential. Thank you.